Hello everyone, myself Dr. Sarthak Patnaik, arthroscopic and sports surgeon. Today I am going to discuss you about one of the most important ligament which is commonly injured in many sports personnel, and it is a matter of concern in certain times because there is a bit of confusion regarding its treatment management. So the ligament which I am going to speak to you about is posterior cruciate ligament, or the PCL. It is one of the most important ligament of the knee which is present the back side of the knee. So any injury which makes the knee hits the knee from front can cause the ligament of this back ligament, or when the knee goes into hyperextension यानी बहुत ज़्यादा ही सीधा हो जाने से. So I will just try to show you in this model. So this is the knee joint, this is the femur, the thigh bone, this is the leg bone. These are the two side ligaments, and there is a ligament in front. This is the ACL, the small ligament over here in front, and the big ligament which is there is the PCL. So this is the ligament which starts from the femur and ends towards the tibia. So this ligament prevents the backward movement of the ligament of the knee. So when there is a damage of this ligament, this knee tends to come back and causes a posterior cruciate ligament tear. So the patient presents to you with a history of pain in the back of the knee. There might be swelling, there might be slight bruises, blood collection, and it's difficult in walking. So whenever you see a patient who got hit from the front of the knee during while playing a football or ice skating or on driving, and he has got a hematoma collection or blood collection, a bruises back of the knee, we are looking for a PCL type of ligament tear. And how do we diagnose it? The most important thing is rice. The first thing what you need to give is give it rest, give it ice fermentation, give it continuous immobilization. That is very important. And then after few days, and say 3 to 4 days, you can take an X-ray. In X-ray generally the ligaments are not seen. तो बेसिकली हम लोग देख रहे हैं कि कहीं ये कोई बोन फ्रैगमेंट चिप करके ना ले लिया. दैट इज नोन एज PCL avulsion tear. Now there are multiple theoretical evidence which has said that if there is only a PCL ligament tear, it doesn't require a surgery. It can be treated conservatively with proper immobilization and icing and certain medication, and then after few months we can go for a proper rehab and patient is fit. But if there is a gross backward shift of the leg, it's a gross sag of the tibia, या हमारा लेग ऐसे पीछे की तरफ जा रहा है जो हम एक वीडियो में दिखा रहे हैं आपको, then we need a surgery. और इसको हम लोग क्या करते हैं, एक आर्थ्रोस्कोपिक PCL रिकंस्ट्रक्शन करते हैं, जो कि आप ही के बॉडी से we take a ligament from your body and then fix it in the femur side and the tibia side. The technique what you are seeing will be what we practice is an all inside PCL reconstruction, जहाँ पे on the femur side and the tibia side we are fixing it the ligament with the button. So in this video, as you saw, the ligaments are fixed on the front and the back. After this tightening, you can see the backward movement of the knee has been absent. So as you saw, the very fine technique of arthroscopic PCL reconstruction, which is an all inside technique in which we fix on the femur side and the tibial side with buttons instead of the screw technique. This technique helps in early mobilization and we do it frequently. So if you have any problem relating to PCL related ligaments, please share your questions at this specific number, or send your MRI report to this number, and we will be there to treat you. If required, surgical, or else we can give you a 100% result with conservative management also. Thank you. Jai Hind.